We are now joined by Dr. Ashish Jha. He's Dean of Brown University School of Public Health. Dr. Jha, very good to see you again this morning. Thank you for joining us.
Good morning, Gayle. Thanks for having me on.
Yeah, we're glad to have you here. Let's pick up where David left off about getting the vaccine. We can all agree that it's been an epic fail. But now as we move forward, the Biden administration, of course, wants to correct that. They're saying 100 million shots in the first 100 days. Sounds very ambitious. Do you think it's doable?
You know, Gayle, I do. I do think it's doable. I think what the Biden team has laid out as a plan is, somebody described it, maddeningly obvious. It's basic public health. It's the federal government helping the states. It's getting more vaccine sites set up. I think if we do all of that, I think we can do 1 million shots a day over the next 3 months.
You know, we were talking at the table in David's report. They said they're going to set up a facility in a garage. Is that okay with you? Tony Dokoupil said, "I'll take it wherever, however." Is that okay with you?
Me too.
And Anthony Mason said the same.
I'm with you guys. I feel like, look, we want to set it up anywhere where it's safe to do so. You want to have space where people can come, they can get their vaccine, and I like the idea of setting it up in, in stadiums and in gyms, and all of that is great as long as we make it accessible to the American people.
So, as we sit here today, less than half of all the vaccine doses that have been shipped have been administered. Why is that happening, and how do we close the gap?
Yeah, so I think, first of all, things are starting to get better. I think the reason is there was no federal planning whatsoever. Basically, they gave the vaccines to states, but states didn't have any resources. They didn't have much in the way of planning. States are figuring it out, and they're starting to get going. And I think we'll see this even ramp up further once the federal government gets involved and starts helping states.
When do you expect that the vaccine will be available for everybody?
Oh, it's a great question, Gayle.
Yeah.
I think, I will. I think majority of Americans should start seeing it be available for them in April to May if everything goes well. Obviously, that could slip to June, but certainly by summertime, I think anybody who wants a vaccine should be able to get one.
Okay. Listen, I just want to hear any date at all, because before we had none. But what do you make of the new strains we keep hearing about? Are you concerned about them, these virulent strains that are now seeping in?
Yeah, I am actually really concerned about them. Certainly the UK variant really concerns me because it's so much more contagious and it's going to end up dominating the infections in the United States. So we have a real race right now. These variants are starting to take off across the country, and our job is to get as many people vaccinated and protected as possible before those variants really become dominant and start infecting a lot of people.
All right, Dr. Ashish Jha, always good to see you. Thank you for your time today.